So today I'll be talking on spontaneous breathing. This topic was a pro-con debate in Hyderabad in Jan 2019. So my opponent was Dr. Suresh Ramsuban. So this was a debate rebutting that spontaneous breathing is harmful in severe ARDS. So my contention was to debate that spontaneous breathing is not harmful in severe ARDS. So it is in severe ARDS. So keep those words in mind. So the topics that I would be covering in this debate is spontaneous breathing. My argument is it recruits alveoli better. And my argument is spontaneous breathing improves global hemodynamics. And I'll take you through summary of studies which favor spontaneous breathing in severe ARDS. And I'll be talking about disadvantages of controlled ventilation where there's absolutely no spontaneous breathing. And the trial which sort of favors controlled mechanical ventilation and critical about uh, spontaneous breathing, which is the accuracy trial, and which we follow right now, that we relax the patients with severe ARDS. So we'll talk about limitations of this accuracy trial, take home message, and after this my opponent obviously would give his version, and then I had a rebuttal after that. So this is the content of my talk. So when we talk about ARDS or any patient, spontaneous breathing. So if you have to support the spontaneous breathing in the setting of hypoxemia, we have two modalities. So we have invasive ventilation and non-invasive ventilation. So I wouldn't be touching non-invasive ventilation because the role of non-invasive ventilation in severe ARDS and allowing them to breathe spontaneously is very low. So there's not many studies, so we would not argue on that. So my talk will only be covering about invasive mechanical ventilation and whether we could allow patients to breathe spontaneously. So when you look at the summary conclusion of this particular review study, which came in Current Opinions in Critical Care by the German group, so here they do make a mention the maintenance of spontaneous breathing during mechanical ventilation is considered as the least invasive method of lung recruitment. So what basically in this Current Opinion, which is a very good journal, which is a good review journal, so they do mention that making someone breathe spontaneously is the best way to recruit the alveoli. And why they say that? Because when an individual or a patient is breathing spontaneously, so the ability to recruit alveoli is better because of pleural participation in the breathing, because even the pleura is involved in the breathing, and that has a bearing on good recruitment of alveoli. How does that happen? We'll see from these studies. So if you look at the